I was diagnosed with the high blood sugar. Up to this moment, I've lived with this condition for the last 7 years, and I'm continuing taking drugs and being disciplined to do what the doctors are telling me. At the same time, we have come and formed an organization, a CBO for Homa Bay County, where we all want the patients to come together so that we are able to influence policies, to influence the decision making, and also to support each other by providing psychosocial support at the community level and at whatever level, and even forming partnership with others that would give us the help that we require, which the government is not able to give today. So we are out to see and to ensure that there is care for our patients, that there is the rights are observed, and there is accountability on all the facilities and even the equipment and materials that we are supposed to use. Why are we not getting the drugs, just like the other drugs for other diseases? What is so special about the drugs of NCDs that they cannot be available? Today in Homa Bay County, we only have Marindi and Nyalkinyi, just the two facilities. Why can't we have it and expand it to other health facilities? So these are things that we are set to touch base with the decision makers and also the policy makers, including the government and any other, and even forming partners that would avail these kind of services closest to our people.
Tunakuwa tunaomba serikali kama inasekana watuletee huduma karibu nyumbani, hata tukitoka tunaenda tutembea kwa mguu, tunaenda tunasaidiwa alafu tunarudi nyumbani. Hata hii mashine za kupima watu tulikuwa tunaomba serikali siletwe huko nyumbani, ndio tunaenda karibu, tunapimwa, tunajua hali yetu. Angalau itatusaidia kuweka pesa, alafu pesa tutumie kwa school fees ama kwa mambo zingine.
Diabetes is not just a diagnosis, but also there is need for the people who have this disease to be able to access the care and the treatment that they need. Diabetes affects patients, it affects families, and it affects communities. That's why there is need for us to make sure that those people who have this disease are able to go on with their daily lives without facing a lot of challenges. Diabetes, if it is diagnosed and it is left untreated, can cause a lot of problems, rendering the patient ineffective in his or her daily work. And such type of patients would not contribute to any economic development of the country, and they will not be able to take care of their families, and they will end up being paralyzed in all aspects of life. That's why it is important that whenever we diagnose diabetes, we are able to treat it, making the resources available for the people to be able to go back to their routine work.
Most of the time it has been realized that people with this disease, sometimes they suffer, they get alienated, or they get discouraged and think their life is difficult. Around the Luo land, they might say something they've been bewitched. So those are the mysteries we want to get them out of. We want to make sure they access care. We want to make sure care is given to them. That is why even this information is with our community health promoters. They can get it right at their doorstep. It can be managed sometimes by the drugs that are injected and then the ones that are swallowed orally. But then there is also a nutrition and a lifestyle management. So before you get to the drugs, you are assessed and we see whether we can advise you on how to live. Because just by changing your diet, you can be able to manage diabetes. But it gets to a time when it exceeds that, or the one that was being generally talked about as the one that gets children. That one, most of the time, it's treated by the injectable. Our partners support us so much on provision of drugs, but as a county, we also try. You know, counties, we have had challenges, but with each day we are trying to get over the challenges.